If you're a parent, you've heard this statement before. Mom, I'm bored. There's nothing to do. If you're not a parent, you probably heard it too. Well, a skilled nursing facility of any flavor, you're going to have something for your residents / patients / clients to do. Now, a patient like Ted that we talked about in week 1 is not going to have a whole lot of interaction happening, but that does not change the fact that he will have to have some interaction with real people throughout the day that can meet whatever limited needs that he might have. The patient who has catastrophic brain injury is in need of interaction as much as any other person, and that's what we're going to have you thinking about in week 11, is that with your population of your virtual skilled nursing facility, what kind of activities are you going to need? If you chose to have a facility that has many patients like Ted or Joan, they need interactions that are not going to be necessarily overly physical, but they need mental interactions, spiritual interactions, social interactions, someone to read to them, someone to chat with them, even if that's with the new mechanical voices or a blinking system in the case of Ted. Joan was a painter. You would want to keep that up, so you'd want to have the physical therapist, the occupational therapist, a activities person or set of people keeping your patients interested in life, giving them what all of us want, which is love and nurturing and things to go out and do. People who don't have that, we've seen for years and years. There's not a picture out there that you don't see the elderly person sitting in the wheelchair staring out the window, obviously depressed, just totally bereft of any activity. So read about the things that you need to be doing for your patients, and then develop some sort of programs that meet their social needs, the psychological needs, their spiritual needs, chapels, religious activities, going to the zoo, having friendships, having social hours, having a Wii bowling tournament. I think those are the Wii was the best thing for skilled nursing facilities that it's come across in a long time, because it's cheap, it's easy for the clients and patients to work with. It's a great program, so be sure to put Wii bowling and other things in your skilled nursing facility. Think about pet therapy. If you were going to have pet therapy, would you have a special room, or would you let them go into the rooms? I know when I was in hospice we had pet therapy, and this was years ago. It was a very new thing then. This lady brought her dog. She had 2 dogs that she brought, and there was a cat too. She didn't often bring them at the same time, but the 2 dogs always came. One was a small kind of Scotty dog that could get in bed with the patients if they were able to tolerate that. And then one was this huge bull mastiff. His name was Bud, and Bud was huge. And if the bed was at even a fairly high level, he could literally just walk up to it and put his head down on it and look at the patient. And you just don't know how joyful a pet can be for somebody who is stuck in bed, and if they like animals. And the look on their faces, and just be able to pet an animal and interact with an animal, because they're so loving and they don't have opinions about whether or not you should or shouldn't be getting an IV, etc., etc. It's just amazing what pet therapy will do for patients. So are you going to do those sort of things? And how are you going to do it? And how is your staff going to cope with that? Do you need to hire more staff, or do you just use the staff that you have? And if your staff is engaged in building a puzzle with Ted or John or Mary, then they're not doing something else. And that all has to be integrated into the entire plan, because you have things that have to get done, things that have to get integrated, things that need to be documented, etc. But you also need to meet the needs of your patients that are not medical, that big social, psycho, and spiritual piece. And then I want you to think about sex in your facility. How do you deal with consensual sex? How would you policy make somebody who met someone else down the hall and they want to get together and have some smooching or maybe more going on? To us, it may seem unusual, but it's not. We are sexual beings, and even if we're aged sexual beings or hurt sexual beings, we are still sexual. So that's an important part of this social and psychological and spiritual makeup of each of us. So how would you meet that need in your virtual skilled nursing facility? So as we're wrapping up in week 11 and then taking your tests, you will have built a virtual skilled nursing facility. And yes, it's been excellent preparation for your NAB exam if that's what you're interested in doing. Hopefully, though, it has brought to you information that you will use for a lifetime no matter what profession you end up in, because it will have taught you the elements that there are people, there are building, the environment of care, and there are the people who take care of the sick, the injured, or the elderly, and that interaction that allows them to be fully taken care of, to be taken care of as a whole, not just as a medical element, as a test tube for learning. It is the people that we are here to serve, and we are those people. We will be receiving this care someday. We want this system to work well for everyone, no matter whether they can pay or not. Don't let this learning go by the wayside when you're finished. This learning is for a lifetime. It's about your lifetime, and it's about the lifetime of everybody you will ever teach. If you can teach even a small amount of this to somebody at your in your environment, you will have improved the world and the care of all of us, because it's all interconnected. So make an interesting set of activities. Remember that food plan that you did last week and think about, what if you really couldn't have that food plan? Would it make your day less fun? If you could have a taco day where you could build your own, would that be more fun than being shoveled Brussels sprouts and dead turkey on a tray? Or is Wii bowling more exciting than sitting and looking out a window with nobody to talk to? Just thinking about it from your point of view of how you would like to be treated, or how you would like your mom to be treated, or your child to be treated if you ended up in a skilled nursing care facility. It's been fun chatting with you all via this modem. Obviously, the discussion board is open all the time. Continue to share experiences with each other over the years, and take the learning that you have in this very kind of niche care area and share it with other people no matter where you're at. Thank you very much, and study well.